Hello everyone, welcome to our educational webinar performed by medical specialist of IVMED Medical Centre and specialist by IVMED Family Agency. My name is Irina Doroshenko. I will be the moderator of this webinar. I'm medical coordinator at IVMED Family Agency in IVMED Clinic. Okay, so I just tell you that our topic of today's webinar is male infertility, spermogram, and micro-TESE. The questions that we will discuss today, it's male infertility and options of treatment, sperm analysis, how to prepare and what the specialist can tell you according to your results, different sperm tests, what is micro-TESE and its effectiveness in infertility treatment. Our today's speakers is Birol Aydin, Director of IVF Laboratory at Medical Center IVMED. He's official expert of Society for Human Reproduction and Embryology, and Maksym Korobko, andrologist, embryologist, and Dr. Veronika Ulanova, MD, obstetrician-gynecologist, fertility specialist, doctor of the highest category, co-founder of Medical Center IVMED. And also Daria Serebryakova, she is also our medical coordinator. She will help us with translation. I want to remind you that we have our general chat, so please don't forget to ask different questions which you want to clarify with our specialists. After the presentation, they will let you know and we will discuss it and get the full answer. So let's start. Please, Birol, you can start.
Okay, hi everyone. I will try to talk today about micro-TESE surgery. So micro-TESE is the unique technology which we are using for azoospermia especially. Also we are starting to use after different kind of research, scientific research for the high sperm DNA fragmentation, which is effective to get low concentration of the DNA fragmentation of spermatozoid and to increase the chance of pregnancy, also increase chance of the IVF outcomes. So why this technique is unique? Because this technique is doing by spatial microscopy and special skills of the andrologist or urologist, because we are trying to get exactly seminal tubules of the testes. So while we are going directly to production center on the testes, so while in this case we can find high quality of spermatozoid, also we can find low DNA fragmentation because apoptotic, like programmed cell death mechanism is working well in the production center, so we can get exactly a perfect quality of DNA quality of spermatozoid through epidemical channel. There are two kinds of azoospermic situation, obstructive and non-obstructive. Of course, when patients go through infertility, there are two cases. While they don't have any sperm production or very low sperm production, and second way, they have another situation like varicocele, like another genetical mutation or disease which they can be able to leave sperm sample. So in both cases, there is a solution by the use technology, also different kind of treatment. So mostly we are interested with, of course, non-obstructive because like 80% of IVF cases coming from this part. If we talk about obstructive, so when patients have specially kind of operation and testicular surgery like a varicocele, main thing, of course, before the operation, they have to freeze their sperm sample because after varicocele, there are two options. First situation, patient can lose all sperm activities for while time, or patient can have very low sperm concentration. Either patient can lose all sperm activity. In this case, of course, while patient will have varicocele operation, best practice before this operation to freeze semen sample. If patient has low concentration or of sperm material. There are different kind of antioxidant therapies by the andrologist, also multivitamin therapies, also like natural diet. But of course, all these therapies cannot make dramatical change on the number of spermatozoids. In this case, of course, IVF is the best choice. We can do different kind of technology in the laboratory. We can get better chance to find high quality spermatozoid for fertilization. If patient has totally azoospermia, then this is the critical issue. Then we have to use kind of technology. As we talked that both way, obstructive and non-obstructive, there are different kind of situation. Obstructive patient have normal sperm production, but there are kind of mechanical blockage or, as I say, different kind of vasectomy or different kind of infection reason. If we go about non-obstructive, of course, sperm production either very low, either totally absent. In this case, we are going mostly testicular surgery. So if we check this diagram, as we see, mostly when we get obstructive azoospermia, if it is genetically, mostly there is no spermatozoid. After vasectomy, so almost 95% of cases lose the activity or very low spermatozoid, especially if have some post-infectious disease. Almost 100% have question about quality of sperm or number of concentration. So what we are doing in this case, 10 to 20% of men, infertile men, is going to IVF clinics. 60 and 70% of azoospermic men as well is going to get kind of treatment through IVF centers. Of course, there are different kind of therapy, hormonal therapies, but on the end, for the especially time limit patients, is best solution will be testicular surgery. So there are different kind of testicular surgery. First is, as we are calling TESE, testicular aspiration. By the special needle, we are entering to epididymis and we are trying to get spermatozoid from the channel. If we are talking about regular TESE, okay, we are cutting this tissue of testis and we are trying to just get part of tissue. But if we are talking about microsurgical testicular surgery, that's we are using special microscope, we are entering through the channel and to find production center of spermatozoid. As you see on the picture, so when we look the microscope, we can see exactly production center of the testicular tissue. On the eyes, any urologist or andrologist will not be able to see the production center. So they will just take the testicular part. If we are lucky, we will find. But with micro-TESE surgery, with microscope, we detect the place and there is no chance to miss. So micro-TESE technique will be to totally detect the sperm on the exactly place who doesn't have any kind of sperm production. Of course, technique is working with microscopic. That's why we can find the exact production center with naked eye. That is not possibility. And also another advantage, we don't open testicular tissue so big. So that's why patient recover faster even after the operation. After 1 day, patient can walk and can do other activities by the micro-TESE. But regular TESE, of course, this will not be possible. As you see, there are special equipment and monitoring for micro-TESE. So we go through the epididymis, we just make a small cut, and with special scalp, just we catch the tubules, and embryologist or andrologist try to find spermatozoid inside of tubules. So why micro-TESE technique is unique? As I said, this needs special equipment, special invest, and also expert andrologist which get educated and get training for the micro-TESE surgery. I will show a video how we are doing a micro-TESE surgery quickly. So we are trying to go with small scalpel. We are opening the surface of the testis, and when we open the surface of testis, we just enter the tubule site in epididymical site, and we are able to see with the special microscope exactly place of the tubule. Now, the video will show exactly how we are determining with microscope those tubules. So there are different kind of many tubules, but most of them will be empty. So as you see, it's a almost small cut. Just when we open the epididimical site with spatial microscope, so we are able to determine exactly place of production center. Now they will show us the production center. So then you will understand why this technique is so unique. As you said, we find even all production center of tubules. In this case, we only take little tubules, and there is no chance to miss any kind of spermatozoid. But microwave, of course, there is chance. We will open testis, we will take the tissue, but we will not find anything because there is possibility we miss production center. So if we see the different kind of research between regular testicular surgery and micro-testicular surgery, there are big difference as percentage, almost 20% difference, like how we found spermatozoid. That's why micro-TESE surgery is the unique. If we look after the sperm injection, what we found on micro-TESE surgery, it's very high fertilization rate, also really high clinical pregnancy rate. Mostly there is no difference than regular normal zoospermic patient because we are getting the high quality of sperm which doesn't have apoptotic programmed cell death or which doesn't have high percentage of sperm DNA fragmentation. That's why we get good quality of clinical pregnancy. So if we check between ejaculate and testicular surgery spermatozoid, which we fertilize, we see also testicular surgery give better fertilization rate, better pregnancy rate, and also high quality of embryo rate. That means we get exactly good quality, DNA quality of spermatozoid. So what about sperm DNA fragmentation? Because this is also a critical issue. Sometimes we decide to do micro-TESE surgery. So sperm DNA fragmentation mostly is not a routine analysis for the spermogram. So we should catch some kind of information, historical information of patient while we are deciding to sperm DNA fragmentation. Sperm DNA fragmentation is totally correlated with oxidative stress. So during sperm transit between epididymis, also sperm DNA fragmentation is a reason of the poor reproductive outcome and miscarriage as well. So which is the best method for sperm DNA fragmentation? Mostly all clinics are using special kits for the detect of DNA fragmentation. In IVMED clinic, we are able to use special kit, of course, and soon we will start to use tunnel technique, which will give exactly result of sperm DNA fragmentation because laboratory sensitivity and validation is very high in the tunnel method than regular kit. So if we compare micro-TESE and sperm DNA fragmentation, after the micro-TESE, we found in the ejaculated 23% of sperm DNA fragmentation. In same material with testicular surgery, we found only 4%. So that shows why micro-TESE is unique. If we check DNA damage in ejaculate and testicular tissue, also we found same things. In ejaculate is very high DNA fragmentation, but in testicular tissue, which we found spermatozoid, very low sperm DNA fragmentation. What can we do to decrease sperm DNA fragmentation? Also, of course, andrologist can give some oral antioxidants. Lifestyle can change. Avoid smoking, weight loss, all will help. But of course, main help will be about sperm chip technology, also micro-TESE surgery. Also, I will show how microchip sperm chip is working, microfluidic sperm chip. It's a short video how we are doing that. Actually, when we get the spermatozoid, there are two ways to make it. If concentration is well, we are avoiding centrifugation. We are using directly semen sample, but if concentration is low, we are doing through centrifugation. So while we found all spermatozoid through sperm chip, according to their chromosomal heavity and DNA, sperm start to move inside of channel, special channel, which determine their DNA. Some kind of sperm will move and will pass from this channel, but most of them will stay another side because they have some kind of chain broken on the DNA. That's why they cannot pass this special channel. So when we found in the main hole, we just use which DNA is not affected. So if we talk about IVMED result, about sperm chip, how we get, so we already have a very high fertilization rate, almost 84%, like between sperm chip and without sperm chip, almost 10-15% difference we see for the fertilization rate and blastocyst rate. If we use standard sperm selection, we got from same sample 83%, but with sperm chip, 90% of fertilization rate. The same thing if we check about embryo quality rate, almost 15% highest, and of course clinical pregnancy outcome also 10-15% higher than regular standard sperm selection.
Thank you so much for such interesting and presentation and video. Thank you. Okay. And our next speaker is Maksym Korobko. Maksym, please, your start.
Hello to everyone. Okay. So my topic will be spermogram, testing and diagnostic value. The number of couples who has been dreaming of a baby for years but have troubles with conceiving is quite large, and almost half of the infertility cases is due to male factor. Therefore, the examination of men's health is as important as women's, and the spermogram is the most important link in the study of the reproductive function of men. First of all, we need to know what means like term like spermogram. The term spermogram means analysis of the ejaculate used in medicine to establish the fertility of a man and identify possible diseases of the reproductive system. A spermogram is necessary as part of the study of the cases of infertility married couple, because as already we maintained, often it depends on the male factor. The study allows us to diagnose male infertility after injuries, in case of infectious disease, in the case of hormonal disorders resulting from chronic disease such as prostatics or varicocele, and during infertility treatment. Taking a sperm test is also necessary if the man wants to become a sperm donor or is preparing for preserving of sperm. Preparation from spermogram is the set of measures aimed at improve the accuracy of analysis results. Before getting sperm, you must stand by to conditions such as sexual abstinence for at least 84 hours and no more than 7 days. Within 7 days before the spermogram, you must do not drink alcohol in any quantities, avoid visiting sauna, steam bath, thermal bath, and other rooms with very high temperature, exclude vibration effects, spicy foods, and do not take medications. Even before the test, you need to exclude heavy physical exercise, conflict situation, and at night it is recommended to have restful and good sleep. In IVMED clinic, we make spermogram with a microscope, and result of your spermogram will be ready usually after 2 or 3 hours. The standard spermogram contains two main categories. The first category is microscopic characteristics that reflect the physiochemical parameters of the semen fluid. The volume of sperm obtained, color, smell, texture, viscosity, liquefaction time, exicity, and mucus. The second category reflects the microscopic characteristic of several elements like sperm count and motility, white blood cell count, red blood cells, agglutination, and sperm aggregation. And structural features of the cell, like percentage of normal, abnormal, and immature forms. In assessing of fertilizing ability of a man, it is fundamentally important to take into account all indicators of the spermogram at the same time. In addition, the characteristics of sperm are highly variable, and in 3 months, ejaculate will be completely renewed. That's why, before analysis, it is necessary to consult with a doctor who will send you to spermogram. As a rule, a standard examination consists 2 or 3 spermograms. In these images, you can see the example of abnormal spermogram that may be encountered in the study of your ejaculate. As you can see in the picture, there is a quite few large such type of abnormalities. After your andrologist will see your sperm, he gives you a general results. If the patient has all the indicators within normal limits, so in this case he has normal zoospermia. If he have some another indicators, then will be different results like oligozoospermia, astenospermia, teratospermia, oligoastenoteratospermia, or azoospermia. Also another diagnosis will be. Identify pathologies can be caused by various cases, such infection, genetic disease, hormonal imbalances, the effect of X-ray or radiation exposure, and toxic effects of drugs or alcohols. Spermogram not only allows you to evaluate the reproductive function of man, but also reflects his lifestyle. The result of analysis cannot be interpreted according to the pattern. All conclusions and interpretation of spermogram can only be done by a qualified andrologist, like andrologist in IVMED clinic, who is able to take into account a lot of individual factors. The accuracy of diagnosis and the correctness of the prescribed treatments depend on the description stage. Moreover, the diagnosis is made not only on the basis of a spermogram, but also a complete history of the patient, the result of other examinations and analysis. Also, an important analysis is in our clinic is like sperm DNA fermentation, which Birol Aydin speak before. Which estimates the number of damaged cell and the quality of the genetic material. Also, mark test, which allow to detect the presence of anti-sperm antibodies of motility spermatozoa. And that's all. Thank you for your attention.
Thank you for the presentation, Maksym. It was also very interesting. I saw that we have a lot of questions, and we start with questions right now. And the first one, I see that it will be to Dr. Veronika. Dr. Veronika, we are planning to have a child and want to prepare for that. My husband is 40. Is spermogram enough, or does he need other tests? Daria, please need your help.
Здравствуйте, доктор Вероника. Мы планируем завести ребенка и подготовиться к этому процессу. Моему мужу 40. Достаточно ли ему только сдать спермограмму или ему нужно еще какие-то дополнительные тесты?
Здравствуйте. Ну, конечно, базовым исследованием является исследование спермограммы. Хотя в возрасте после 40 желательно делать более углубленные обследования, то есть сделать такое исследование, которое называется ДНК-фрагментация спермы, которое позволит определить процент накопленных генетических поломок в хвостиках сперматозоидов, что может быть ассоциировано у мужчин с возрастом. Если показатели спермограммы общие и анализ на предмет ДНК-фрагментации спермы в норме, это не требует обращения к урологу. Если анализы будут не в норме, это требует обращения к специалисту. Спасибо за вопрос.
So, of course, the spermogram is the most basic testing, but according to the age, during 40 years old, it's better to do also DNA fragmentation. This test will show how the percentage of chromosomal abnormalities in spermatozoa, in spermatozoa cells, and if the spermogram and the DNA fragmentation test results are okay, so you don't need to, your husband don't need to visit urologist, but if there are any abnormalities or any abnormal results in the testing, it's better to visit the urologist, and thank you for the question.
Thank you. The second one, hello, my partner has 54% DNA fragmentation. Is it better to use sperm chip or to do TESE? I think this question to Birol.
Okay. Actually, we have standard test standardization up to 30% for us in the risk category. So when patient has up to 30% of sperm DNA fragmentation, we are asking firstly andrologist consultation. Of course, there are two options. First option, to use directly sperm chip technology, which will increase the chance of IVF outcomes. And secondly, if our andrologist or urologist give high recommendation for microtesticular surgery to identify exactly low quality of sperm DNA fragmentation, then we are following the second way. But of course, a decision is doing by all together by our team, embryology, andrology, and together with patient. But mostly in such cases, we are solving the problem by the easiest way. I mean, we are trying firstly idea of sperm chip. If situation is critical, if patient have some history, IVF history, let's say 5-6 IVF trial, low embryo development or no blastocyst outcome, then we are trying to go micro-TESE surgery.
Thank you. The next, Maksym, will be for you. My husband is thinking to freeze sperm for the future, but he's worried about mix of the material. How does your lab avoid material mixing?
Good afternoon. This is a good question. In our clinic, use like two systems of control of biological material. The first is the system of second witness, when someone working with your material, and in this time, the second embryologist or andrologist is checking all steps or actions of this first embryologist. The second system is the system IVF ID. This is the first in Ukrainian electronic system for protection date and biological material of patient. The system completely controls our every steps and excludes any human factors. So you can be sure your biological material will be never mixed in our clinic.
Okay. The next one to Birol. Hello, how many times in a year does IVMED micro-TESE? What is IVF success rate after TESE?
Of course, I mean, there are two ways of micro-TESE. First is azoospermic micro-TESE, and second, reason of sperm DNA fragmentation. While we are so selective about sperm DNA fragmentation, we don't have huge number of micro-TESE. Also as azoospermic, we don't have huge number, but I can say yearly we have around 50 to 60 micro-TESE surgery. As I share on my presentation, if we use micro-TESE as sperm DNA fragmentation solution, we have up to 59% of clinical pregnancy outcome. But if we use that for azoospermic, on the most of the azoospermic cases, our sperm found rate is 79%, and our clinical outcome after the fertilization, blastocyst outcome is 74%, and clinical pregnancy outcome is 71%. So we have high pregnancy outcome after the micro-TESE, and that is the normal, should be like this, because we have to understand we are just getting poor quality of spermatozoid through channel. Of course, this increases the chance. But of course, this is unique, as I say. I mean, you cannot find in any different clinic such technology. Okay, there are several clinics in the world keeping such technology and expense, but finally, we are giving this service to our patient, and our IVF outcomes is good about this.
Okay. The next question to Dr. Veronika. My husband and I are trying to get pregnant for 3 years. Doctors say that I have kind of allergy reaction to sperm, the damaged sperm, and makes it impossible to get pregnant. Please, doctor, what can we do in this case?
Мой муж и я, мы пытаемся завести ребенка, забеременеть 3 года. Доктор говорит, что у меня своеобразная аллергическая реакция на сперму мужа, которая как бы уничтожает сперму и делает это невозможным забеременеть. Доктор, подскажите, что мы можем сделать в этом случае?
Спасибо за вопрос. Проблема несовместимости, так называемая, когда есть антитела у женщины, которые повреждают сперму супруга, может быть решена такой репродуктивной технологией, как внутриматочная инсеминация. Для этого нужно, чтобы были проходимы трубы, то есть это исследование является обязательным.
In this case, there is a reproductive technology that you can put your sperm in the uterus, and firstly, before that, you need to check your fallopian tubes. It's really important that to get pregnant.
Должен быть достаточный яичниковый резерв, то есть хороший антимюллеровский гормон у женщины, и показатели спермы должна быть нормоспермия.
Also, to do this procedure, you also need to check your AMH level to be sure that you have ovarian reserve, and also you need to check. Your husband need to check his sperm, and to do the spermogram and sperm testing. There should be normospermia.
Если ситуация позволяет, можно обсуждать такую процедуру, можно делать до 6 попыток. Если результаты не получили, это показание говорить о программе ЭКО, которая также может решить эту проблему. С другой стороны, программа ЭКО может ускорить вероятность наступления беременности.
So you can try this type of procedure for 6 times, but if there are no result, you can also try IVF, and maybe in some cases IVF will be faster to get pregnancy.
Спасибо за вопрос.
Thank you for your question.
Thank you. The next question is, if we use sperm after TESE, do we need to do PGD? Birol, it's to you.
Okay, they are not correlated exactly to each other. Okay, PGD is the unique test for genetic abnormality of the embryos. Of course, either if patient have normozoospermia, we always suggest to patient to have PGD testing or NGS testing, especially after 35 years old. Because of reproductive age, so there are abnormality of embryo rate is increasing. So, but especially of course for the micro-TESE, okay, they have let's say less chance to get high quality of embryos. But finally, they can have only one-time testicular surgery because this is traumatic situation. And we are trying after the testicular surgery to freeze a sperm sample, like I'm for 3-4 trials minimum. But sometimes, of course, we are not able to do that because depends of amount of tissue or amount of spermatozoid. Of course, in this case, best way to try to make NGS and PGD testing after testicular surgery and to increase chance of clinical pregnancy and euploid embryo.
Thank you. The next one to Maksym. Can abnormal sperm analysis lead to miscarriage or children with birth defects?
Okay, I understand abnormal means like some chromosomal abnormalities or like fermentation, DNA fermentation of sperm. And yes, if you have abnormal sperm, it can lead to miscarriage and or children with birth defect. But of course, even if the FISH diagnosis relates abnormalities, not all sperm cells possess these abnormalities. It depends on sperm quality. In the case, we propose make preimplantation genetic diagnosis of embryo in our clinic. If you have high DNA fermentation of sperm, so we can propose to use in our clinic like special sperm chip or use TESE.
Thank you for the answer. The next question. Hello, I have a question to Birol Aydin. My partner has been diagnosed with cancer. He will need chemotherapy, sorry, maybe I'm not correctly said it, chemotherapy, but we want to have a baby. What we can do? Do we need to freeze sperm before chemo?
Okay, so this is the, finally in my working experience, I found a lot of such mistake who done by the andrologist, by the urologist, or by the patient. Mostly for such situation when they need the chemotherapy or special cancer treatment. Of course, before that, for sure, they need to freeze their sperm because of two reasons. First reason, as I said, after this therapy, because of different function of the body cells, they can lose all activity of spermatozoid. So that is possible. Testis cannot produce any more spermatozoid or very low. And second things, because they will get chemotherapy and amount of radiation will increase in the body. And of course, this will affect the genetic quality and genetic aneuploid rate of spermatozoid. And it will affect directly to quality of embryo. And also during the pregnancy, it will affect the healthy baby life birth. So definitely they have to freeze before to start the chemotherapy, their spermatozoid.
Okay, thank you. Next question to Dr. Veronika. Question to a doctor. My husband is 35. He does sports but smokes every day. We are planning to have children. Is there any medicine to improve sperm quality?
Вопрос доктору. Моему мужу 35, он занимается спортом, но курит каждый день. Мы планируем завести детей, и есть ли какие-то препараты, которые могут улучшить качество его спермы?
Спасибо за вопрос. Ну, первое, что нужно сделать, это все-таки обследоваться, то есть сдать анализ спермограммы, чтобы понять, что там нету выраженных проблем.
Firstly, thank you for the question. Firstly, it's better to do spermogram to check if there are any problems with sperm.
Так как лечение мужского бесплодия, самолечение, на самом деле может быть очень небезопасным, и это требует все-таки назначения доктора.
Because if you take medicine by yourself, it can have negative effect on sperm, and it's better to do testing and to visit doctor.
Если выраженных изменений в показателях спермограммы нет, в качестве общеукрепляющей терапии можно применять.
So if the spermogram is okay, so in general you can take
Препараты, которые содержат цинк, селен, аргинин, также полиненасыщенные кислоты омега-3. Это то, что улучшает качество спермы.
So in general, your husband can take medicine that contains zinc, selen, and omega-3.
Аргинин, омега-3.
And also arginine, yeah, and also arginine, and all these supplements can help to improve sperm quality.
Также витамины группы А и В увеличивают количество здоровых сперматозоидов.
Also, vitamins group A and group B increase the quantity of healthy spermatozoid.
Витамин С улучшает правильную передачу ДНК.
Also, vitamin C helps to improve the getting of the DNA.
Витамины D и Е защищают акросому сперматозоида.
Also, vitamins D and vitamins E helps to save the DNA.
Все эти витамины входят в поливитаминные комплексы. Спасибо за вопрос.
So all these vitamins are in the vitamin complex that you can get, and thank you for the question.
And also another question for Dr. Veronika. Can taking testosterone supplements affect my husband's sperm quality and ability to conceive a baby?
Еще один вопрос к Веронике Валерьевне. Могут ли добавки тестостерона, добавки, которые повышают уровень тестостерона, повлиять как-то на качество спермы и на возможность зачатия ребенка?
На самом деле, еще раз повторюсь, заниматься самолечением в этой ситуации неправильно, так как тестостерон очень важный гормон, который имеет очень много эффектов в организме у мужчины.
Thank you for the question. Firstly, doctor, also one more time, it's better to visit a doctor and don't do self-medicine and self-treatment. And the testosterone is really important hormone in the male's body.
Тестостерон действует в организме через тестостероновые рецепторы, которые находятся повсеместно, практически во всех органах и тканях.
In every organ of the male's body, there is testosterone receptors, and it also affects the testosterone level.
Количество этих рецепторов у нас в организме ограничено, поэтому обычно нормальных уровней тестостерона достаточно для реализации тестостероновых эффектов в организме у мужчины.
So usually there are a lot of testosterone receptors in the body, so it's usually enough for the normal testosterone levels.
Чаще всего тестостерон и его аналоги, так называемые анаболические стероиды, применяются в качестве допинга мужчинами, которые активно занимаются спортом и хотят улучшить свою атлетическую форму, так как здесь используется их анаболический эффект, то есть эффект, который увеличивает мышечную массу, стимулирует синтез белка, что позволяет достичь достаточно быстрых эффектов.
Usually the men who does sports, they use these testosterone supplements to get more muscles, and these testosterone supplements do some anabolic effect, and it increases muscles and the ability to do sports.
Но при этом надо помнить, что тестостерон пероральный имеет очень выраженный гепатотоксический эффект, то есть он очень повреждающее действие оказывает на печень.
But also when you take these testosterone supplements, you need to perioral supplements. You need to remember that it can have toxic effect on the liver.
Тестостерон, который вводится инъекционно, и его аналоги, анаболические стероиды, при этом надо помнить, что оказывают эффект на все органы и ткани при их длительном применении в высоких дозах, и, соответственно, имеют много побочных эффектов, в том числе и ухудшают качество спермы.
So when you take the injections of the testosterone or anabolic steroids, it also it has an effect on every organ of the body and on different organs of the body, and also it can affect the ability to conceive a baby.
Поэтому неоправданное длительное применение тестостерона и его аналогов в высоких дозах не очень положительно оказывает влияние, не очень положительное на репродуктивную функцию и на организм мужчины в целом.
So when you take these testosterone injections for a long time, or other anabolic steroids for a long time, it has negative effect on different systems in the body, especially on the reproductive system.
Когда речь идет о назначении тестостерона по медицинским показаниям, при доказанном синдроме недостатка тестостерона доза тестостерона должна подбираться доктором.
So if there is a medical reason to have testosterone injections or supplements, so the dosage should be prescribed by the doctor.
Вот в таких ситуациях правильное назначение тестостерона будет влиять на функцию выработки сперматозоидов. И только тогда это оправдано.
In this case, when the doctor prescribed the dosage of the testosterone, if there is a medical reason for that, the right dosage and the right level of the testosterone will help to produce normal spermatozoids.
Спасибо за вопрос.
Thank you for the question.
Thank you. The next question, I have heard that oxidative stress test is not reliable. Is it true? Maksym, please.
Thank you for the question. Sperm oxidative stress reveals the amount of reactive oxygen species, or how it calls ROS, in the patient's seminal fluid. According to the recommendations of the World Health Organizations, the determination of the level of active oxygen species is included in the list of recommended examination methods for male infertility and pregnancy development disorders. In our IVMED clinic, sperm oxidative stress assessment is performed by measuring the oxidation reduction potential, or P, using the Meoxys system analyzer. So this analysis is really very important for restoring male fertility and choosing the most effective method of assisted reproductive technologies.
Okay, and one more question. If motility is low, are there chances to get pregnant, or IVF is the only option?
Okay, I think this is a question for me. If you have like low sperm motility, it means you have astenozoospermia. This is the main factor of low fertility in males. The extent of medical intervention in zoospermia is different and depends on the reasons. The male reproductive system cannot function properly without the necessary substances for the rise motility of your sperm. It's like L-carnitine, antioxidants, vitamin E and B9, zinc and selenium. The production of normal sperm is prevented by tight-fitting underwear. Also, men with poor sperm motility are advised not to take a hot bath and saunas. Experts recommended wearing loose, non-restrictive clothing. But if none of these treatments proposed by your doctor, of course, did not help, so it is an occasion to think about IVF in our clinic.
Thank you so much for the answer. The next one, I think, will be to Birol. If we use sperm after TESE, do we need to do PGD?
Okay, Vicky wants for this question, but once again, I will give. Okay, it's okay.
Sorry, I just think that I'm not talking about.
Okay, but let's give once again. Yeah, I mean, as I say, PGD is the different for the embryo aneuploidy because chromosomes is coming from the male and from the female. So this is complex, kind of complex gene reaction. So for any patient who is going to do IVF, especially after 35 years old, main suggestion of all experts and ours also to done PGD or NGS to choose euploid embryos. So this will be, first will be cost effective. Second, they will not lose time for anomaly embryos to transfer and they just get disappointed. And third, of course, psychologically, that will be positive from their side. They will be sure like they are carrying up a healthy baby, and also they will be sure they have big chance for the pregnancy. Doesn't matter we have micro-TESE or regular normal zoospermia, we always suggest to do NGS or PGD testing.
Thank you again for addition. The next, my brother wants to do vasectomy or reversal procedure. Is there any chance that he will have an opportunity to have children?
Of course, before vasectomy, it's very important to get a spermogram test. If he has spermatozoid, for sure we need to freeze, because 40% of the cases after vasectomy operation, we find out they lose activity for the several period after the vasectomy testing till testes recover mechanically themselves, or they lose total activity. So in this case, of course, best way to freeze spermatozoid, but still 50-60% of vasectomy after the operation, they continue to produce spermatozoid. But of course, there's a big risk to take before the operation. Best way to freeze sperm sample.
Thank you so much. And the last question, I saw that this participant prepared, so there will be a few questions. I have low anti-Müllerian hormone and my husband has low sperm quality. Are there any chances for us to have a baby? We are thinking about embryo donation, but still want to try to have our own child. And it will be, I think, question to doctor, the patient mentioned. Again, we are talking about motility. If motility is low, are there chances to get pregnant, or we need IVF? Also, if the patient has a low anti-Müllerian hormone and her husband has low sperm quality, what to do? We were thinking about embryo donation, but still want to try to have own baby.
По порядку. У меня низкий АМГ, и у моего мужа низкое качество спермы. Есть ли какие-то шансы для нас забеременеть, завести ребенка? Мы думаем про донацию эмбрионов, но еще хотим, может быть, попробовать завести своего собственного ребенка. И вопрос к врачу, возможно ли это? Есть ли какие-то шансы?
Спасибо за вопрос. На самом деле недостаточно вводных для того, чтобы ответить на этот вопрос однозначно. Но,
to be honest, we don't have a lot of information to give the whole answer for the question.
Здесь важно понимать возраст супругов, в частности, возраст женщины, да, тогда будет понятно, насколько действительно целесообразно бороться за свои яйцеклетки. Если возраст до 40, да, возможно, даже при низком АМГ вероятность получить правильный эмбрион, в общем-то, есть. Опять-таки, можно рассмотреть вариант накопить oocyты и повысить вероятность получить правильный для переноса эмбрион.
So firstly, we need to know the age of the couple, of husband and wife, and especially the age of the woman. For example, if the age is before 40, even if the AMH is low, there are still chances to get pregnancy and to have a child, and one of them, and also to have a good quality embryo. And one of the options is to do several stimulations and to preserve several oocytes, and after that to get embryo.
С точки зрения супруга надо понимать, что значит низкое качество спермы. Возможно, это будет требовать дообследования в варианте фрагментация ДНК спермы, то есть определить количество разрывов или повреждений цепочек сперматозоидов, и, возможно, микро-TESE, о которой рассказывали наши эмбриологи, также позволит улучшить ситуацию, да, и позволит получить правильный на перенос эмбрион.
So talking about husband side, we need to know what is low sperm quality and if there are any abnormalities. So doctor recommends to, for example, to do a DNA fragmentation test and to see if there are any chromosomal abnormalities in the spermatozoids. And also, as our speakers told today, micro-TESE can also help to have good quality of embryos.
Если возраст супругов старше 40, тем не менее, при некатегорически низком АМГ можно пробовать свою стимуляцию, получить свои клетки, но при этом надо обязательно обсуждать генетическое исследование эмбрионов перед тем, как переносить их в полость матки.
So, if the age is after 40, both of husband and wife, you can try to do own stimulation, but also before the embryo transfer, it's better to do preimplantatic genetic test and to check if there are any abnormalities in the embryo.
Спасибо за вопрос.
Thank you for your question.
Thank you for the answers. We have already answered on all questions. So I want to thank you all participants of our webinar and our specialists who provide us an answer on all questions and provide interesting information. Next webinar will be dedicated to surrogacy program in IVMED Medical Center. So we invite you. Thank you for your time. Stay care about yourself and your families, and see you next time. Thank you.